Narcan, a life-saving tool in the fight against opioid overdose. In the United States and many other countries around the globe, the overuse of opioids has turned into a serious public health problem. Opioids are a group of narcotics that includes both legal and illegal substances like heroin, as well as prescribed painkillers like oxycodone, hydrocodone, and fentanyl. If not handled right away, respiratory depression brought on by opioid overdoses can be deadly. Naloxone, an opiate antagonist, is sold under the trade name Narcan. It functions by attaching to the brain's opioid receptors, preventing their effects, and restoring respiratory depression. An auto-injector, nasal mist, or injection can be used to give Narcan, which is regarded as a secure and reliable emergency therapy for opiate overdose. As the drug epidemic has gotten worse, Narcan use has expanded considerably in recent years. The U.S. Surgeon General advised in 2018 that more people, including drug users, their friends and family, and first responders, should bring naloxone. Additionally, many states have enacted legislation that makes naloxone more broadly accessible without a prescription. It has been demonstrated that Narcan is very successful at stopping an opiate overdose. Over 26,000 opiate overdoses have been effectively stopped by naloxone, according to the Centers for Disease Control and Prevention (CDC) between 1996 and 2014. It's crucial to remember that Narcan does not heal opiate addiction or undo the consequences of narcotic use. It is an instrument for preserving life in urgent circumstances. Narcan has the benefit of being reasonably simple to administer, even for those without medical instruction. Particularly easy to use and training-free is the nasal mist form of Narcan. Although it can induce withdrawal symptoms in those who are physiologically reliant on opiates, it is safe and has few adverse effects. Another benefit of Narcan is that it works against all opioids, including the extremely potent synthetic opioid fentanyl, which has been implicated in numerous overdose fatalities in recent years. Given that fentanyl is a much more powerful opioid than other opioids, it may be more challenging to rectify an overdose brought on by fentanyl. However, studies have shown that Narcan is still useful in fentanyl overdose situations. However, Narcan is not without its drawbacks. Making sure Narcan is accessible when and where it is required is one of the major challenges. In some situations, individuals might not be able to correctly administer Narcan, or they might not have access to it when they need it. The price of Narcan has come down recently, but some individuals and organizations may still find it prohibitively costly. The short-term effectiveness of Narcan presents another problem. Despite the fact that Narcan can stop an opioid overdose and save a person's life, it does not deal with the root problems that caused the accident in the first place. Opioid addiction is a complicated problem that needs a multifaceted strategy, including methods for harm reduction, therapy, and prevention. To sum up, Narcan is a vital weapon in the struggle against opiate poisoning. It is reasonably simple to give and is very efficient at undoing the effects of an opioid overdose. It is essential to treat the root problems that lead to drug use and overdose because it is not a cure for opioid abuse. Access to Narcan and other harm reduction techniques can be improved, which can lower the number of drug fatalities and save lives. Along with making Narcan more broadly accessible, it's critical to keep funding methods for harm reduction, therapy, and prevention that deal with the underlying causes of the drug epidemic. As part of this, more people will have access to resources for mental health and addiction recovery, secure opioid prescription techniques, and non-opioid pain relief. We can avoid overdoses and enhance the health and well-being of people, families, and communities impacted by this terrible epidemic by adopting a holistic strategy to the opioid problem.